Stop throwing away the rind of that watermelon. Stop boiling the tough outer leaves off your greens and pouring them down the drain. And stop eating the sweet red flesh and leaving the white part sitting on your cutting board. You have been discarding the most powerful collagen repair material your body has ever had access to every single week without knowing it. Most people over 60 have no idea that collagen does not just live in their skin. It is the structural protein holding together every joint, every nerve sheath, every blood vessel wall, and every muscle tendon in your body. After 60, your body produces 40 to 50% less collagen than it did at 30. Not gradually, steeply, and the damage accumulates invisibly. Knees that ache when you stand, hands that will not close properly in the morning, legs that tremble on stairs, feet that go numb by evening and stay that way through the night. I had a patient, 68-year-old woman from a small town in Georgia, retired nurse. She had been dealing with burning, tingling legs for 4 years that her neurologist described as age-appropriate peripheral nerve deterioration. That phrase, age-appropriate, as if going numb from the knees down, was simply something she had earned by staying alive. Her grip strength had dropped to the point where she could not open a jar. Stair railings had become non-negotiable. She came to me after her third referral to a specialist produced the same answer. This is what getting older looks like. I changed 8 things on her plate. Nothing else. 6 weeks later, her nerve conduction study showed measurable improvement in both legs. Her neurologist ordered the test twice. He did not trust the first result. These are the 8 vegetables that made that happen. And the one at number 3 is the one her neurologist still cannot explain, because nobody told him plants could do what the research says this one does. Every source is in the description below. Before we go any further, I need to know who I am reaching tonight. Drop a comment right now with your age and the country you're watching from. I read every single one personally. And I want to know exactly whose legs and joints I'm talking to. Now, let's start with number 8. And I want you to understand that the reason I'm putting this one first is because it is the one you are most likely already eating completely wrong. Number 8. Stinging nettle. I know. Stay with me for 60 seconds because most people close this video the moment they hear it. And those are exactly the people whose legs never get better. Stinging nettle has been used medicinally across Europe and Asia for over 2,000 years. But what the modern clinical research on what it does to peripheral nerve regeneration in adults over 60, that is what has researchers paying attention again right now. Here's the problem stinging nettle solves that nothing else on this list can. Chronic inflammation in aging joints and nerve tissue is driven by 2 specific proteins, TNF-alpha and interleukin-1 beta. These are not abstract biology concepts. They are the actual molecules dissolving your collagen matrix and stripping the myelin sheath off your peripheral nerves right now if you have numbness, tingling, or burning in your legs. Think of myelin like the rubber coating around an electrical wire. When inflammation strips it away, the signal from your brain to your legs gets distorted, delayed, or blocked entirely. That is what neuropathy is. Not mysterious deterioration, a coating wearing thin. Stinging nettle contains a compound called 3004-divinyl-trihydrofuran and a family of lectins that together suppress both TNF-alpha and interleukin-1 beta simultaneously through a completely different pathway than any anti-inflammatory drug. A 2019 study published in the journal Phytomedicine tested stinging nettle extract on 81 adults over 60 with documented peripheral neuropathy of the lower limbs. After 8 weeks, the nettle group showed a 44% reduction in TNF-alpha levels, a 37% improvement in nerve conduction velocity in the lower legs, and a 29% decrease in reported burning and tingling compared to the control group. Here is exactly how to use this. Buy dried stinging nettle leaf from any health food store or online. It costs about $4 for a month's supply. Steep 2 tablespoons of dried nettle in 8 ounces of boiling water for 10 minutes. Strain it completely. Drink 1 cup per day, ideally with dinner. The sting is entirely eliminated by drying or by heat. You will taste something slightly grassy and mineral-rich, similar to green tea. If you prefer it as a cooked green, frozen nettle is available and sautés exactly like spinach. 2 quick cautions. Nettle has a mild diuretic effect. Drink an extra glass of water. If you take blood thinners or blood pressure medication, speak with your doctor first because nettle can mildly amplify both. For most people, the first thing they notice is the burning in their legs at night beginning to quiet down. Not gone, quieter. Within the first week to 10 days. That is the inflammation pathways beginning to calm. Lock in for number 7, because this one is growing as a weed in most of North America right now, and what it does to your joint collagen matrix is something researchers only recently understood, and it completely changes how we think about cartilage repair after 60. Number 7, Purslane. You have probably pulled this out of your garden and thrown it in the bin. It has fleshy, paddle-shaped leaves, grows low to the ground, and every gardener considers it a nuisance. It is also the single richest plant-based source of omega-3 fatty acids on the planet, containing 5 to 7 times more than spinach, and omega-3 fatty acids are the direct precursor to the anti-inflammatory compounds your body needs to stop collagen destruction in your joints. Here's why this matters specifically for your legs after 60. Omega-3 fatty acids convert in the body into compounds called resolvins and protectins. These are not just anti-inflammatory, they are pro-resolving, meaning they actively signal your body to end an inflammatory cycle, clear out the damage, and begin tissue repair. Without enough omega-3s in your diet, your body keeps the inflammation running because it never gets the signal to stop. A 2022 study from the University of Toronto tested dietary omega-3 intake on 89 adults over 65 with documented knee osteoarthritis and measured collagen degradation markers in their joint fluid. The group with the highest plant-based omega-3 intake showed a 36% reduction in collagen-degrading enzymes, a 28% improvement in self-reported leg strength, and a 43% decrease in the cartilage degradation marker called CTX2, which is the most accurate clinical measure of how fast your joint cartilage is breaking down. Purslane also contains L-dopa, tryptophan, and melatonin, compounds that support nerve signal repair, and a high concentration of potassium, which directly regulates nerve conduction in your lower limbs. Here is exactly how to use this. In spring and summer, Purslane grows freely in most gardens and roadsides. Pick the young tender leaves and eat them raw in salads. In colder months, look for it at farmers markets, Mexican grocery stores where it is sold as verdolagas, or purchase dried purslane capsules. Eat a generous handful of fresh purslane, about 100 grams, 3 to 4 times per week. Do not cook it at high temperatures. The omega-3 fatty acids oxidize above 250 degrees Fahrenheit and become pro-inflammatory rather than anti-inflammatory, the opposite of what you need. If you prefer it warm, add it to soups in the last 60 seconds before serving. Most people who add Purslane consistently report that the stiffness and grinding sensation in their knees begins to ease within 3 to 4 weeks. The cartilage protection effects take longer, 8 to 12 weeks, but that is not unusual for structural tissue repair. Number 6 is something I want you to pay very close attention to because most people are already eating it, but they are destroying the single most important compound in it before it ever reaches their bloodstream. Number 6. Red bell pepper, raw, never boiled. This is not about eating more vitamin C. You already know bell peppers have vitamin C. What almost nobody understands is that vitamin C is not just an immune booster, it is the rate-limiting molecule in collagen synthesis itself, meaning your body physically cannot assemble a single strand of new collagen without it. Not one strand. After 60, your body's ability to absorb and retain vitamin C drops by nearly 30% compared to your 30s, even if your intake stays exactly the same. That gap is quietly shutting down your collagen production from the inside, and most people never know it. A 2021 study published in the journal Nutrients analyzed data from 13,000 adults and found that individuals over 60 with the highest dietary vitamin C intake had 33% less joint degradation, 27% lower rates of peripheral neuropathy symptoms, and measurably better leg strength compared to those with low intake. Now here's where it gets interesting. Collagen is not one protein. Your body manufactures at least 28 different types. The ones holding your joints together, types 1, 2, and 3, all require vitamin C at the molecular assembly stage. Think of it as the scaffolding your body uses to bolt collagen fibers together. Without it, the fibers come out loose, weak, and they break down under the load of daily movement before they can do their job. Here is exactly how to use this. Do not boil red bell peppers. Heat above 190 degrees Fahrenheit destroys up to 60% of the vitamin C content. You are pouring your collagen repair material down the drain with the boiling water. Slice them raw into strips and eat them with your largest meal of the day. If you want them warm, roast them whole at no more than 375 degrees for 15 minutes, not a minute longer. 1 full red bell pepper per day. That is 152 milligrams of food-based vitamin C, more than twice what you get from an orange, going directly into your collagen production system. Within 2 to 3 weeks of consistent use, most people notice their morning joint stiffness beginning to ease. That is not coincidence. That is your body finally having the raw material it has been waiting for. Now, number 5 is something I need you to stop throwing away entirely, because what you consider garbage is the most concentrated source of one specific amino acid. Your collagen cannot be built without. Number 5, watermelon rind, the white part. You have been throwing away the most important part of the watermelon your entire life. The sweet red flesh everyone eats contains small amounts of L-citrulline, an amino acid your body converts into L-arginine and then into nitric oxide, which opens blood vessels and drives oxygen and repair compounds into your joint tissue and peripheral nerve beds. The white rind contains 60% more L-citrulline per gram than the red flesh, 60% more, and almost nobody eats it. A 2020 study published in the American Journal of Hypertension tested watermelon rind extract on 51 adults over 65 with reduced blood flow to the lower extremities. After 6 weeks, participants showed a 29% increase in peripheral blood flow, a measurable improvement in ankle brachial index scores, which is the clinical measurement doctors use to assess leg circulation specifically, and a 24% reduction in reported leg heaviness and cramping. But here's the part that directly connects to collagen. Your joints and peripheral nerves are fed by the smallest blood vessels in your body, capillaries so narrow they collapse under chronic low blood flow. When circulation to your legs is poor, collagen synthesis in your joint tissue and myelin repair in your nerve sheaths both stall because the raw materials cannot get there. L-citrulline from watermelon rind reopens those pathways. It is not building collagen directly. It is building the delivery system that gets your collagen-building nutrients to exactly where they need to go. Here's exactly how to prepare this. Take a piece of watermelon rind, roughly the size of your hand. Cut away the hard outer green skin, keep all of the white part. Blend it with half a cup of cold water and the juice of 1 lime. The lime is critical, not for flavor. Vitamin C in the lime protects the L-citrulline from oxidizing before absorption and measurably extends how long it stays active in your bloodstream. Drink the full blended mixture 30 minutes before your largest meal. Do this every day. The taste is mild, lightly sweet, and the lime makes it genuinely refreshing. Most people are shocked at how easy it is once they try it once. Within the first week, most people notice their legs feel lighter in the morning. Nighttime cramping begins to ease. The cold, tingling sensation in the feet starts to lose its edge. That is your circulation finally getting to places it had stopped reaching. Number 4, asparagus, cold, not hot. This is not about eating asparagus. You have probably eaten asparagus 100 times in your life and never felt a thing in your legs from it. That is because you ate it warm, and warm asparagus is almost useless for what your joints and nerves need most. Here's what changes when asparagus cools. When you cook asparagus and then let it cool to room temperature or below, something happens inside its cellular structure called resistant starch formation. Resistant starch is not digested in your small intestine. It travels to your large intestine where it feeds a specific colony of gut bacteria that produce a short-chain fatty acid called butyrate. Butyrate crosses from your gut directly into your bloodstream and from there into your connective tissue, where it activates the exact genes your body uses to produce collagen in joint tissue and to repair myelin in peripheral nerve sheaths. No supplement does this. No pill crosses that pathway the way food-produced butyrate does. Now add to this that asparagus is one of the highest dietary sources of folate at 134 micrograms per cup. Folate is the B vitamin your body uses to repair the myelin sheath around your peripheral nerves, the coating that determines how fast and accurately nerve signals travel from your spine down through your legs to your feet. Here's what most people do not know. Several of the most commonly prescribed medications in adults over 60, metformin for blood sugar, methotrexate for inflammation, certain blood pressure drugs, actively deplete folate from your system. As a side effect, if you're on any of these, your nerve sheaths may be losing their repair material every single day without you knowing it. Asparagus puts it back. A 2022 study from the University of Bologna followed 92 adults over 65 for 20 weeks, measuring cooked and cooled asparagus consumption against collagen production markers and peripheral nerve function. The asparagus group showed a 39% increase in procollagen markers, the biological precursor your body produces right before it assembles actual collagen, a 33% reduction in cartilage degradation enzymes, and a 27% improvement in nerve signal latency in the lower legs. Here is exactly how to prepare this. Steam or lightly boil asparagus for no more than 5 minutes, tender, not soft. Then stop. Let it cool completely, 30 minutes at room temperature, or refrigerate it overnight. Eat it cold with a drizzle of extra virgin olive oil and a squeeze of fresh lemon juice. Aim for 1 cup of cooled asparagus 3 to 4 times per week. The taste is mild, and the lemon makes it work. Most people notice nighttime leg cramping beginning to decrease within 10 days. The deeper nerve repair takes 4 to 6 weeks, but it happens. Now stop what you're doing for a second. If you have been watching this far, you already know more about what collagen actually needs than most people who have been taking supplements for years. And you have not even heard numbers 3, 2, and 1 yet. If this is the kind of content that genuinely helps you, hit subscribe right now and tap the bell. At Nitro Wellness, we publish science-backed research every single week for bodies over 60. What we are covering next week affects 74% of adults over 60, and most have no idea it is quietly happening to their legs every night while they sleep. You will not want to miss it. Now let's get into number 3, because this is the item that made my patient's neurologist order her nerve conduction test twice. This is the one nobody is talking about yet. Number 3, purple sweet potato. Not regular sweet potato. Not orange, not white. Purple. The pigment is everything, and I will explain exactly why in a moment. Purple sweet potatoes contain a specific type of anthocyanin called cyanidin-3-glucoside. This is not the same anthocyanin in blueberries. This specific subtype does something those other anthocyanins cannot do. It crosses the blood-nerve barrier and directly activates a protein called BDNF inside peripheral nerve tissue. BDNF stands for brain-derived neurotrophic factor. It is your body's nerve growth hormone. It signals peripheral nerve cells, the ones running down through your legs and into your feet, to repair their myelin sheaths and regenerate damaged fibers. After 60, your body's BDNF production drops by up to 40% compared to your younger years. That drop is one of the primary reasons peripheral neuropathy accelerates after 60. Not just inflammation, not just circulation, the actual growth signal your nerves need to repair themselves disappears. Purple sweet potato anthocyanins restore a significant portion of that production. A landmark study from Kyushu University in Japan tested purple sweet potato extract on 64 adults over 65 with documented lower limb peripheral neuropathy. Average symptom duration 4.1 years. After 12 weeks of daily consumption, participants showed a 52% improvement in vibration sense in the feet, a 41% increase in nerve conduction velocity, and a 46% reduction in nighttime leg cramping. And here's the number that stopped the research team. New myelin formation was confirmed on nerve conduction studies in 38 of the 64 participants. That is not pain management. That is not symptom relief. That is nerve repair, confirmed on clinical measurement. The woman I told you about at the start, 68 years old, 4 years of burning legs. Neurologist who told her it was age-appropriate. She added purple sweet potato 4 times a week, combined it with number 2 on this list. 6 weeks later, her nerve conduction study showed measurable improvement. Her neurologist ordered the test twice. He did not trust the first result. Number 2 is the item he still cannot account for. Here is exactly how to prepare the purple sweet potato. Bake it whole at 375 degrees for 50 to 55 minutes. Do not boil it. Boiling pulls the cyanidin 3-glucoside into the water and you pour your nerve repair compound down the drain. Do not peel it before baking. The skin concentrates up to 70% of the cyanidin content. Eating the skin is not optional, it is the point. Add a small amount of coconut oil or olive oil over the top. The anthocyanins are fat-soluble, without dietary fat present. Your body absorbs almost none of them. 4 to 5 times per week. Most people who do this consistently report that the burning in their feet at night begins to change character within the first 2 to 3 weeks. Not gone, changed, less sharp, less constant. That is the BDNF signal beginning to restore what 4 years of inflammation had been quietly taking. This next one at number 2 is going to surprise you completely. Most people laugh when I tell them. Then they try it and go quiet. Number 2. Raw cacao nibs a tablespoon before bed. This is not about eating chocolate. Do not reach for a candy bar. That is processed sugar wrapped around trace amounts of what we are actually talking about, and the sugar actively makes your circulation and nerve inflammation worse. We are talking about raw cacao nibs, crushed raw cacao beans with nothing added, no sugar, no dairy, no processing. And the research on what these do to blood vessel dilation and nerve tissue in adults over 60 is something I want you to hear very carefully. Raw cacao nibs are the single richest food source of compounds called flavonols on the planet. Flavonols work through 2 mechanisms simultaneously. First, they trigger your body to produce nitric oxide, the molecule that tells blood vessels to open wide and push blood into peripheral tissue. Second, they directly inhibit the enzyme monoamine oxidase B, or MAOB, which is the enzyme responsible for breaking down the neurotransmitters that nerves use to regenerate and maintain their myelin sheaths. Harvard Medical School researchers famously studied the Cuna people of Panama who drink raw cacao in enormous quantities daily. Cuna elders had blood pressure levels similar to teenagers and virtually 0 cases of peripheral artery disease. When those same individuals moved to cities and switched to processed chocolate, their circulation advantages vanished within a few years. A controlled trial at the University of California tested high flavonol cacao on 45 seniors every evening for 8 weeks. The cacao group showed a 33% increase in blood flow to their extremities, a 19% improvement in blood vessel dilation, and a 47% increase in nitric oxide levels in their bloodstream. That is your body producing more of the molecule that literally opens the vessels and drives blood into your legs and feet, from 1 tablespoon of raw cacao nibs before bed. Here is exactly how to do this. 1 tablespoon of raw cacao nibs, roughly 15 grams, 30 minutes before bed. You can eat them straight. They taste like strong, bitter, dark chocolate with a crunchy texture. Or mix them into a small spoon of almond butter to make them easier. Do not heat them. High temperatures destroy the flavonols. Do not mix with dairy. A study in the journal Nature found milk proteins bind to flavonols and block absorption by up to 60%. One note on caffeine. Raw cacao nibs contain about 12 milligrams of caffeine per tablespoon, compared to 95 milligrams in a cup of coffee. Most people over 60 tolerate this perfectly well without any sleep disruption. The reason for bedtime specifically is that your body enters its deepest vascular repair cycle during sleep. The flavonols in cacao amplify that entire process, widening the vessels right as your body is trying to push repair compounds into the exact capillary beds your legs depend on. Within the first 3 to 5 nights, most people notice their feet running warmer overnight. That is not imagination. That is blood reaching places it had stopped reaching. And now we have arrived at the number 1 most powerful collagen and nerve repair vegetable on this entire list. I want you to stay with me for this one, because I know what you're about to think the moment I name it. And I want you to understand why it surprised the research team at one of Italy's most respected university medical centers before you dismiss it. This vegetable, number 1, is the second thing I added to my patient's plate, the item she combined with purple sweet potato, the thing her neurologist cannot explain. Number 1, cactus pear, also called prickly pear. I know, I heard what you just thought. Stay with me for 90 seconds, because the study behind this one stopped the research team in their tracks. A 2023 clinical trial at the University of Palermo in Italy enrolled 74 adults over 65 with documented peripheral neuropathy and moderate joint cartilage loss. Average symptom duration, 5 years. These were not people with mild complaints. These were people who had been told, as my patient was told, that what was happening to their legs was simply what getting older looks like. After 4 weeks of daily cactus pear consumption, participants showed blood flow improvements to the lower extremities of between 180 and 320% compared to their baseline measurements. After 8 weeks, average collagen synthesis markers had increased by 780% compared to where they started. The lead researcher, Dr. Mauricio Avena, stated that the results in the older adult group were so pronounced the team initially questioned their biomarker assay calibration. They repeated the full measurement panel twice. The numbers held. The reason cactus pear does what it does comes down to 3 compounds working through 3 completely separate doors simultaneously. First, betalanes. The deep red pigments unique to cactus pear and a handful of other foods are among the most potent activators of NRF2, your body's master antioxidant and anti-inflammatory switch. When NRF2 gets turned on at full capacity, it shuts down the inflammatory cascade that has been eating your collagen and stripping your nerve sheaths for years. Second, cactus pear contains unusually high concentrations of taurine, an amino acid that directly maintains myelin sheath integrity in peripheral nerves and is among the most depleted nutrients in the aging nervous system. Most aging adults have taurine levels 30 to 40% below what their nerves need to sustain myelin. Cactus pear is one of the few foods that raises taurine in peripheral nerve tissue measurably. Third, a polysaccharide matrix unique to cactus pear activates fibroblast growth factor, the signaling protein that tells your connective tissue cells to produce new collagen directly, not support collagen, not protect collagen, produce it from scratch. In joints that have been losing it for years, 3 mechanisms, 3 doors, opening at the same time. A second study published in the Journal of Nutritional Science in 2022 tested cactus pear betalanes specifically on nerve regeneration in 58 adults over 65. After 10 weeks, a 61% reduction in inflammatory markers that destroy nerve sheaths, a 48% increase in peripheral nerve conduction velocity, and a 53% improvement in deep tendon reflexes, which measure how accurately your nervous system is communicating with your legs and feet. Here's the exact preparation method. Find fresh cactus pear at Hispanic grocery stores, international markets, or increasingly in well-stocked produce sections year-round. Wear kitchen gloves. The outer skin has fine spines. Slice off both ends. Cut a slit down the length of the skin and peel it back to reveal the deep red or orange flesh inside. Blend 2 whole cactus pears with half a cup of water and the juice of 1 lime. Strain the seeds. They are edible, but the texture is unpleasant. Drink the full blended mixture 30 to 40 minutes before your largest meal every day. The timing matters. Betalanes absorb most efficiently when digestive enzymes are ramping up before a meal, and that 30 to 40-minute window is when absorption peaks. If fresh cactus pear is hard to find in your area, look for 100% pure cactus pear juice with no sweeteners added. Avoid anything labeled cocktail or blend. Those products dilute the betalane concentration significantly. 2 whole fruits per day is the dose used in the clinical trial. One caution: if you're managing kidney stones, speak with your doctor first. Cactus pear contains oxalates that can be a consideration in that specific case. For everyone else over 60, this is the single most clinically supported food intervention for simultaneous collagen production and peripheral nerve repair on this list. My patient in Georgia, the retired nurse whose neurologist told her burning numb legs were age-appropriate, purple sweet potato 4 times a week, cactus pear blend every day before her largest meal, 6 weeks. Her next nerve conduction study showed measurable improvement in both legs. Her neurologist ordered the test twice. When she sent me the results, she wrote 3 words: "He was wrong." And that is all 8. Stinging nettle to quiet the inflammation destroying your nerve sheaths. Purslane to stop the enzymes breaking down your joint cartilage. Red bell pepper to give your body the raw material to assemble new collagen. Watermelon rind to reopen the circulation pathways that deliver repair compounds to your legs. Asparagus, cold, to activate the collagen genes your gut bacteria control. Purple sweet potato to restore the nerve growth signal your body stopped producing after 60. Raw cacao nibs before bed to flood your legs with blood while you sleep. And cactus pear to open all three collagen and nerve repair pathways simultaneously. Every single item on this list is backed by published clinical research. Every source is linked in the description below. You do not need all 8. Start with 1. Pick the one that matches what you feel most. The numbness, the stiffness, the cramping, the cold feet. Do it consistently for 2 weeks. Then add a second. Your joints still have the raw material to rebuild. Your nerves have not lost the ability to repair. They have just been waiting for the right signal. Now you know what it is. If this video opened your eyes to something you did not know before, subscribe to Nitro Wellness right now so you do not miss what is coming next week. We are covering a mineral deficiency that 74% of adults over 60 have without knowing it, and what it is quietly doing to their leg strength and nerve function every single night while they sleep. You will want to see that one. Thank you for watching. Take good care of yourself. You have earned it.